Did you know that about 1 in 36 children are identified with autism, according to the CDC? For these kids, sensory sensitivities are more than just occasional quirks. They're a big part of their daily lives, and each child is unique in their sensory experiences. Some may be hypersensitive to bright lights, loud sounds, or even certain textures and tastes. Others experience hyposensitivity, meaning they might not feel sensations like hunger or pain as strongly. They might crave sensory input, like seeking out loud noises, bright lights, or even rocking back and forth to feel more connected to their surroundings. One place these sensory issues really show up: meal times. For many children with autism, food aversions and preferences can make it hard for parents to ensure a balanced diet. In fact, children with autism are 5 times more likely to face mealtime challenges like tantrums or extreme food selectivity. Many rely on a few safe foods like French fries, chicken nuggets, or pizza, foods that look, smell, and taste the same every time. Meanwhile, more unpredictable foods like fruits and vegetables can be tough because every bite can be different. This food selectivity can lead to common micronutrient deficiencies and make balanced nutrition a struggle. Some children may only eat a couple of foods or have very specific preferences about brands, colors, and textures. Some might only eat purees, while others prefer crunchy finger foods. And every child's journey with food is unique. There is no one-size-fits-all approach. I'm Colleen Sloan, a PA, dietitian, and your nutrition mentor. Welcome to the Exam Room Nutrition Podcast, your guide to giving better nutrition advice. I'm thrilled to have Brittyn Coleman with us today. She's a dietitian who specializes in autism and brings incredible practical insights to this complex topic. Brittyn is all about making nutrition approachable and effective for both kids and their parents, and she understands the delicate process of helping a child feel comfortable with new foods. Today, Brittyn will share her top strategies for introducing new foods, practical tips for those kids who only eat a handful of foods, and key blood work providers should be monitoring. So if you're a pediatrician looking for ways to support families on their autism journey, you're in for a treat. This episode is packed with actionable insights you can use to make a real difference. So let me introduce you to Brittyn. Brittyn Coleman is a renowned dietitian and autism nutrition expert, known for her unique sensory-friendly feeding methods tailored for children with autism. As the founder of the Nourishing Autism Collective and an autism sibling, Brittyn combines professional knowledge with personal insight. Brittyn is very active on social media and her own podcast called Nourishing Autism. All right, my friend, get settled and enjoy my conversation with Brittyn. Well, hey, Brittyn, thank you so much for your time. I'm so excited for this topic. Thank you so much for coming onto the show.
Thanks, Colleen. I'm super excited to be here.
Well, I'm in the pediatric world, so I'm so excited to dig into this topic of autism with you because this is your wheelhouse and you are the expert in this. And as pediatricians, we get asked these questions all the time. And so I wanted to start out with sort of the nuances with helping families with children with autism because they are on a different level of picky eating because they've got that sensory aspect to it as well. So can you give us some sensory-friendly picky eating approaches that the pediatrician can recommend?
Yeah, you're so spot on. The picky eating really is related so much to their sensory system and that sensory overwhelm. And so the autism community actually prefers to use selective eating instead of the term picky eating because it really more adequately explains what's going on. So what we see is that because eating is such a sensory-rich activity, they're smelling the food, they're tasting the food, they feel the texture, they feel the temperature, everything happens at once. So for kids who are already prone to that sensory overstimulation, eating is just one of their least favorite activities. It's not something that they're looking forward to. But when it comes to this selective eating, a lot of the typical picky eating approaches don't work or they backfire. And so I think that's where a lot of parents start getting frustrated by their practitioners who they're like, well, of course, duh, I know, give them more exposures or just put something new on their plate. And they've been trying all these things, I would bet you, and none of them are working. And so it's helpful to have a little bit of like understanding about autism so that you can try and introduce this new idea to parents to help them understand like why their child is more limited in the foods that they'll eat. So I am going to give you some tips, but I would say one of the first things I would say is to not tell a parent to remove their child's safe foods. Unfortunately, that's one of the most common approaches that any practitioner will take. Oftentimes, I do see that it's a pediatrician because that's what they were taught in school. If a child is only eating junk, take the junk away and they'll just eat something else when they're hungry. But unfortunately, what happens for kids with severe sensory aversions, they're not going to eat when they're hungry. Their like sensory overstimulation trumps any hunger. And so this doesn't work. And it becomes this huge like power struggle, and the child can become malnourished and dehydrated. And it puts them in a way worse place with food and nutrition than before. And sometimes after an experience like that, they stop eating some of their preferred foods. So what was had good intentions, we put the family in a worse situation. So what I want us to do is let's be asking the parent, what are their safe foods? What are the foods that they will eat? How can we make sure that we keep the variety that they already have? We want to build on it, but we also don't want to lose foods just because we forgot about them. And so what I like doing is like, let's make a list together. What foods will your child eat all the time? Like these are their safe foods. What foods will your child eat sometimes? And like, how can we always make sure they have a safe food available and try and sprinkle in those like sometimes or maybe foods every now and then so that we can make sure that we keep them in the rotation? Because I'm a parent and it's easy to lose track of like, okay, what do they eat? And like, oh, I haven't served oatmeal in like 2 months because I just forgot about it. So it's helpful to help keep the parents and have something written down because they're busy and they have a lot on their minds. And the easier we can make it for them to try and keep things in rotation, the better. So that's like the baseline, like minimum where I want to start. And then when it comes to introducing foods, we really have to be super sensory mindful. We don't want to force foods. We don't want to like bribe them. We want to like present them in a very sensory friendly experience. And we usually start super, super small with foods that are similar to that huge list of safe foods we just made. So I think those 2 steps are a really good place to start, where we keep their current foods in rotation, but also looking ahead at which other foods might fit and feel similar. And we could start to introduce in really small quantities and, hopefully help them expand. There's more to it that's oversimplified, but I think those are 2 really great ways that pediatricians could really help out parents and maybe help them look at this in a different way.
I think that's really, really helpful. And I love that you rephrased picky eater to selective eater, because I actually did choose that term intentionally in the beginning because that is what the majority of medical professionals, that is the term that we all use. And if anyone's listened to any of my prior episodes, you know that I'm always the first to correct people when they say and label a child a picky eater, whether they have autism or not, because I do think it is a very limiting term and kids don't like being called that. I always will see parents say, oh, she's really picky. And I look at the child and they're like, hey, no, I'm not. Because to them, it's negative and it limits them. And they think, well, it's just the way that I am. I guess I don't eat different foods, right? So I love that you corrected us. Selective eater is such a great term. And I often will tell parents and I'll say, hey, you know what? Let's rephrase this and let's not call her picky eater, but let's give her a different identity. Let's call her a curious eater. I like the term curious because it flips the identity to like, okay, well, I'm a little nervous, but I'm willing to try or I'm willing to explore these different foods. So I think that is like the most important distinction between using our words properly and making sure that we're labeling our kids so it sets them up for success. So thank you so much for introducing that term selective eater to us because that's so important.
I love the term curious eater too. And there's a few things that I don't talk to kids about, or I tell parents not to talk to their kids about. That is calling them a picky eater, because you take what your parents say is true. Like that's how we're wired, is that our parents are correct. And we don't want to assign that to their personality or that that's just who they are. I don't talk to kids about their weight. I don't talk to kids about foods being good or bad. But yes, I love exactly what you said. That's awesome.
And it's such a simple thing that doesn't take more time for the clinician to do, but it's just a simple switch that really can change the trajectory of this child's eating journey. Now, I want to linger here because I get asked this question all the time, and the parent will say, well, all he eats and all he wants is potato chips and a bottle of milk, right? Now, those are two severely separate issues going on. But then they'll follow up and say, is that okay? Using what you had said about not removing their safe food, because obviously, we don't want this child only eating chips because they are missing out on a lot of micronutrients. But what you just said is to not remove those favorite foods, but build on it. So how would a clinician answer that question? Like, is it okay that all they eat is chips? And then what can they suggest that this parent do?
Well, the parent already knows that that's not enough, and they're probably really stressed about it, even if they're casually asking, is that enough? Is that okay? The first thing that I usually do is validate the parent and that first, you're doing a really great job. This is really hard. Children on the autism spectrum do have additional sensory needs, so it's common for their diets to be limited. The good thing about the milk is that they're getting protein in their diet. They're getting nutrients from here. The carbs that they're getting from the chips are giving them some energy. However, for them to be the most nutritious, for them to get all the nutrients that they need, and for them to really feel good in their bodies, we need more. And I want to introduce you to some resources or some ideas on how we can help them expand, because this isn't sufficient right now. I don't want them to feel bad or guilty, because I think that's where a lot of parents default. And so I keep that in the back of my mind of like, how is my answer helping them like move the needle forward and not keeping them stuck in this like place of guilt? Because that absolutely will hold parents back from like making, changes of like, oh, I did this to my child, or like my child will never get more foods. And I think sometimes letting them know that this is possible, we just have to take the right approach to get there.
I think that's such a great way to start to validate them, because we don't know what they're coming in with. We don't know what it looks like at their house. And I am not a parent of a child with autism, and I cannot imagine how difficult and frustrating and exhausting and emotionally draining that must be to want your child so badly to eat a variety of foods. And you're told this all the time by the clinician, like, we need to have more variety. We need to introduce more fruits and vegetables. And like, it just feels impossible. So I really love how you start by validation and support and encouragement, because really that is what they need. They need a cheerleader. They just need a support team behind them. Now, I have heard of like sensory bins with food, and I'm curious on kind of some fun ways that parents might introduce those new foods without really the child eating them, because that is the ultimate goal, but it takes a long time to get there. So what are your thoughts on some of those suggestions?
I think that oftentimes we get caught in this mentality that eating is the only win, but there are a lot of steps that you have to work up to get to eating. And so if we're forgetting about all those steps in between, we miss the mark and we don't have the progress that we want, and we can't celebrate all of those wins along the way that help keep parents going. So it really depends on where the child, like where their comfort level is with that particular food. So from the very beginning, like the food introduction could be, I actually recommend this to quite a few families who their kids have like severe anxiety around food, or maybe they have ARFID, where we like look at photos of the food. YouTube has some really fantastic channels where they are cutting fruits and vegetables, and you just get to watch. It's not threatening. We can see it on TV. Kids can watch it. They also have like the wooden vegetables, like the toddler ones, that if they're not ready to like look at a banana being cut because it's soft and mushy, let's look at the wooden ones. And you kind of like make your way there. Now, for some kids, they are totally comfortable with touching it or smelling it or even licking it or putting it to their mouth. And so we really just have to figure out their comfort level. And sometimes it takes a little bit of, practice, and it's like an experiment to be able to figure out where do they feel comfortable and what is that small little movement forward that we can, they do get out of their comfort zone a little bit, but we're not putting them into overstimulation because we want growth to happen. So I think sensory experiences are great with food. I do like to introduce one new food at a time so that we can really focus on the sensory experience of that particular food. So if you were to introduce it, I want to do something child-led and fun instead of just saying, can you touch it to your mouth? Can you touch it to your nose? Like for my son, we sat down at dinner the other day He'll be 2 in November. And we got him mac and cheese, which is a food that he likes, but it was a different noodle than he was used to. And he looked at that and was like, no, no. And so I was like, okay, like put my like dietitian hat on right now. What are we doing that's going to help him form a positive connection with this food? I'm going to adjust my expectations right now. He's probably not going to eat this food. So he had a little doggy at the table with him, and it was like a big penne noodle, and it fit on that dog's tail. And I was like, this is so silly. But I was like, Sammy, what do you think about putting a noodle on the doggy's tail? And he was like, yes. And so we did that. And that's what we did. And we put it on, and he like licked his fingers. He put the noodle back. Like he had a positive experience with food, but it wasn't eating the food. But I also knew that's probably not what was going to come out of that mealtime. So I think sometimes adjusting our expectations is helpful, because I was able to have a good time with him and like assign this positive connection to that kind of pasta he's never had before, and kind of move the needle there with a positive connection with food. So sensory experiences are amazing too. I think it's important we don't get our sights set on exclusively eating the food.
I love that, because that's an important place for parents to kind of retain hope. And like you said, like they can then celebrate that win. Like I'm sure this could have been such a different dinner time experience for you, because it's dinner, you're exhausted, you worked all day, you just want your kid to eat and go to bed. Like I'm a mom too, and like that is the end of the day. We are all done. And you could have bribed and forced, and he would have had thrown a temper tantrum. It could have been a totally different experience. But because you shifted your mindset, and I love that you change your expectation. And I feel like parents and even clinicians like don't like doing that. Like they think that's a loss, when in actuality you're winning when you do that, because now, just like you experienced, you can celebrate what your son was able to do. Like that is so cool. He literally licked his fingers. He tasted it, in a way that he didn't even know he was trying it. So I really think that's an important mindset shift of just like changing your expectations.
Definitely. And I think that mindset shift too, it really pulls into how we as parents are showing up at the dinner table. Because when we're anxious and we're overstimulated, I mean, our kids are co-regulating. And so if they're feeling that anxiety, and that's so hard to do, right? When you're anxious and overstimulated and you want them to just eat the food, but your kids do feed off of that. And so one of the first things I actually do with my clients is talk them through mindset and how to show up as your best self. And, sometimes we're going to show up at a mealtime and it's like, I've given all I have today. I don't have time to put a pasta noodle on a doggy tail. The best I can do right now is just like coast. And that's real life too. So I think it's, easier said than done, but there are a lot of things. Like I just try and keep it positive or keep it neutral. Trying keeping away from any kind of negative interaction with food goes a really long way.
Absolutely. I think that's a big takeaway from kind of what I'm hearing from you, is keeping the whole environment, the whole experience positive, so that any future steps forward you try to take, they've already had that positive experience, and it's not going to bring any negative anxiety or negative feelings about it. So I think that's a really good overarching theme with how you work with patients. All right. I want to get into some pediatrician specific questions that they get, that they could probably give some really helpful advice that would give them some solutions. And one of those issues are the gut issues that children with autism have. And it's often constipation because of their limitation in their diet, right? Their diets are usually pretty low in fiber. So they often will come and say, his poop is hard. It's huge. It clogs the toilet. Like, what can I do? Now, as pediatricians, our go-to is going to be a stool softener or a laxative. It's like the number one thing that we suggest. But I would really love to hear from you as a dietitian. What other things can we suggest to these kiddos who are probably in so much pain? It's so uncomfortable, and are also, now it's confounding, they're probably having appetite issues because they've got a big ball of poop sitting in their belly. So what things can we help these parents do to help their poops be a little bit softer?
Yeah, constipation is the number one issue by far. I do see kids with like gas, bloating, diarrhea, but we have really solid research to back up like how significant constipation is in autism. But I want us to make sure that we're viewing this as, yes, it's common. That doesn't mean that it's like normal to be putting every child on Miralax, because it's just, constipation is just something that goes along with autism. It's a symptom that their diet is limited. They're not getting enough fiber. They have low muscle tone, which is common in autism too. They have severe sensory aversion. So like going to the bathroom and having a hard bowel movement is like probably extremely painful for them because of their sensory sensitivities too. So I want us to be thinking of like, okay, what are the pieces that pull all of this together? It often is fiber and fluid. So when we think constipation, those are the two things that we always think about, but there can be other things going on too. So if you're already doing a food journal or like a food log with all of their safe foods, I'll break those safe foods down into 3 groups. I'll look at protein, fat, and fiber. Actually, sometimes it's 4. So like other, like random snacks that fall into that other category. What percentage of foods in here are fiber? And if we're not getting any, it may be a good idea to consider a fiber supplement. And if you're noticing that there's a lot of like sensory aversions around food, like let's get them into feeding therapy too. Like let's work on expanding their diet. But can we fill that nutritional gap now? Because we know expanding the diet takes a long time. So let's get them some relief now. Let's also help them go to the bathroom so maybe they are a little bit more hungry and a little bit more open to trying new things. So fiber supplements, I don't like just like go to Walmart and grab a fiber supplement. There are some particular ones that I want. And that high fiber is a really common one that people will use because a lot of kids will take it pretty well. And there's other powders that can be really beneficial too. There's one called Biotigen I really like and seems to do a really great job of softening up the stools and is flavorless, which is huge for autistic kids. So those are ideas. Magnesium citrate is also a really fantastic osmotic laxative that can really help kids just have softer bowel movements. So Natural Calm is a really common one that people could just grab at the store. Maybe it's not perfect, but it usually does a pretty good job if you dose it right. But I would say fiber and magnesium citrate are 2 really common ones. I even have, families do like if their kid already likes baths, doing like Epsom salt baths that can really help calm their muscles too to relax. We've seen can help with constipation as well. So that can be a really low lift for some families who are already doing baths most nights. So those are some of my go-tos, but we really have to look deeper as to why is this happening. Probiotics are great too, but I usually reach for prebiotics first because I notice that many kids handle them easier, especially if we start lower and then increase versus probiotics sometimes take a little bit to find the right strains that work. And sometimes certain kids just don't respond well to them. It totally depends.
I love your last answer right there. It totally depends because it's so hard to give like, oh, just recommend this for all kids. It doesn't work like that. So I do think what you had said, suggesting a fiber supplement is fantastic because traditionally we would say, oh, just increase their fruits and veggies and fluid intake. But these are kiddos who already are struggling to increase their fruits and veggies intake. So now you're just adding more stress to the parent. So I think it's a great place to introduce a fiber supplement. Now I want to linger on supplements a little bit.
Yeah.
You mentioned fiber supplement, magnesium citrate, some prebiotics. Are there any other supplements that we can either suggest or how do we answer that question when parents come to us? Because I get that a lot of, well, should I put him on a multivitamin? And if you don't know how to answer that, you might just say like, yeah, sure. It wouldn't be a bad idea, but is that a good answer or how should we be suggesting supplements to parents?
Yeah, I would say if the child does have a really limited diet, like you look at this kid's diet and when I say really limited, under 20 to me is like big red flag. If we're getting kind of close to that, it's like they could still benefit from some additional support. The way that I view supplements is that they're a really great way to fill in the gap temporarily while we work on expanding the diet. So that's the same way I view fiber. It's like, let's fill in this gap right now and let's work on getting more fiber foods and gradually like we can wean off of it. Like, let's do this through food if we can. I think multivitamins are the same way. I think the nutrition in our food today, especially in the food that many kids eat, doesn't have optimal nutrition anyway. So I think that most kids could benefit from a multivitamin, even if it's not the full dose. Now, if a child has fewer than 20 foods, without a doubt, they need to be on a multivitamin because especially if their foods are all falling under that like other category, like we're not getting very many vitamins and minerals, the odds that they are deficient in something are pretty high. We actually see really high rates of nutrient deficiencies and autism. And so I would say that would be a good place to start. But again, like I don't want them to just run to the store and grab the first thing they see on the shelf, because a lot of those are pretty cheaply made and they're not like ideal for a child on the spectrum. So I'm usually looking for a multivitamin that's going to have all of our B vitamins, especially at the very minimum. And I would love those B vitamins to be activated. So like, can we do methylfolate? Can we do B12? Like we see in the research that more kids tolerate those forms of B vitamins who are on the autism spectrum, tolerate those forms better. And I don't want iron in it. So if we need iron, let's take it separately because iron can interfere with the absorption of other minerals. And I would love it to have zinc and magnesium. And if we can hit all of our vitamins and most of our minerals, I would be happy with that. But again, we have to come down to like what's realistic, and like the parents saying they will only take this one gummy multivitamin and they won't take anything else. Awesome. Let's keep going. I'd rather you have something rather than nothing. So we don't go to a place of guilt. I always try and keep the parents like, you're doing an awesome job. This is all hard. Let's keep it in. Like, if it's working, it's working. If you can try this other one, we can get some more support. Let's do it. So I think that's the approach that I take with parents. And I even say, like, all of this is an experiment. We're trying to figure out what fits for your child, and what fits for your child may be completely different than what fits for their sibling or from their friend. And so sometimes it just takes us a little bit of time to like learn their preferences and learn what their body is going to respond the best to.
What are your thoughts on oral nutrition shakes like Ensure or Gain, all the different ones that are out there?
Yeah, I think they can be a really great way to fill in the gap, and an easy sensory-friendly way for kids to get some protein. And usually they have vitamins and minerals in there too. There are definitely better ingredients in some of them versus others. And so I really like the brand Kate Farms. I find that many kids will drink them pretty well. Ripple also has like a chocolate flavor. Like, yes, we're thinking about sugar, but we're also thinking about like, what are the other ingredients in there? Like, can we avoid high fructose corn syrup? Can we avoid, 20 grams of added sugar? Can we avoid any artificial ingredients if possible? Like, there are certain things that are ideal, but again, if the child is eating two foods and one of them is Pediasure, and while that's not my personal favorite, I'm not going to take that away. If the parent is really concerned about the ingredients in that food and they're wanting to transition away, we got to add before we subtract. So don't take away the Pediasure or whatever it might be. Let's add in something in a very small amount. We're not trying to sneak it on them because we don't want them to stop drinking the other thing. Let's add it in gradually, build a positive connection, and then we can make the swap. So we want to make sure we do that with someone who knows what they're doing.
I love your approach. I think it's so realistic and helpful for parents, and it's not drastic because that's not going to work for children on the autism spectrum for sure. All right, my last question is, are there any labs that pediatricians should be routinely monitoring and that you would like to see as a dietitian?
You can run all the normal like CBC, CMP, lipids as well if you wanted to. But when it comes to nutrition, I mean, iron is so commonly low and it's so easy to catch, but not only just serum iron, I want to see ferritin. So if they are already doing an iron panel, like let's throw ferritin in there. Vitamin D is another really common one. If you're looking at their diet and you notice that like they're only eating processed foods right now, like maybe it's a good idea for us to add in some other like common vitamins or minerals that we could test. But I would say if you're just like baseline testing, like CMP, CBC, vitamin D, iron, ferritin, like that is the absolute minimum that I want to see.
This was so helpful. You are just chock full of super practical tips for clinicians. And I know my listeners will just so appreciate everything that you've shared today. Where can people find you on social media and learn more about you and what you do?
Yeah, you can follow me online at Autism Dietitian. I'm the most active on Instagram, but I also have a large following on YouTube and Facebook. So that's a good place to connect with me. And then I also have resources for practitioners on my website. As we're recording this, I just launched a 2-part masterclass for practitioners to teach them all about diet for autism. And then in the second part, we talk about selective eating and how to expand a child's diet and support families in that. So you can find all of that at autismdietitian.com/masterclass.
That is so helpful and so needed. Brittyn, thank you so much for your time. I'm so grateful that you spent this time with me. I love to have you back on.
Thank you, Colleen. I appreciate it.
All right, now it's time for my nutrition notes. I want to share 5 things not to do when working with children with autism or when educating their parents who are going through feeding challenges. So, number 1, avoid using the reward system. Using rewards to encourage eating, like if you eat your broccoli, you can get ice cream, may work temporarily, but it rarely leads to long-term acceptance of healthy foods. This can reinforce food aversion and diminish the joy of eating, which is especially unhelpful for children with autism who might already experience food as stressful. Instead, try making food exploration enjoyable, like creating faces with vegetable on a pizza or using pasta sauce for painting. Such activities can reduce anxiety around food and help build a positive relationship with eating through sensory play. Number 2, don't withhold safe foods. The belief that a child will, quote, eat when they're hungry rarely applies to children with autism. Hunger cues can be overridden by anxiety, leading some children to skip meals entirely rather than eat unfamiliar foods. This not only risks dehydration and malnutrition, but can also exacerbate negative associations with mealtime. Including safe foods allows children to feel secure and fosters a less stressful eating environment, which is crucial for children with sensory sensitivities. Number 3, avoid using screens as distractions. Using distractions like a TV or tablet to coax eating can lead to disengaged, mindless eating. Children with autism benefit more from a calm, predictable eating space where they feel comfortable and safe. Sitting together at the table in a spot where the child feels physically secure can help reduce anxiety and build better eating habits. Creating a consistent mealtime routine without distractions allows them to focus on the sensory experience of eating itself. Number 4, don't only serve familiar brands in original packaging. Children with autism often become attached to specific brands or packaging. Instead, take the food out of the original package or place it in different dishes. This can gently expand their palate and tolerance over time. And number 5, don't overlook sensory and physical needs. Sensory overload is common during mealtimes, as many children with autism have difficulties with body awareness and posture, which can make eating uncomfortable. For example, poor core stability can lead to fidgeting or slouching, causing discomfort. Providing physical support like a footrest or rolled up towels around the back can help the child feel more stable, allowing them to focus on eating rather than their discomfort. Incorporating relaxation techniques before mealtime, like deep breathing or blowing bubbles, can also help them enter a calm state, making mealtimes less stressful and more enjoyable. With children on the autism spectrum, there isn't a one-size-fits-all solution for feeding challenges. Instead, adopting a combination of sensory-friendly strategies, family meals, oral motor exercises, food chaining, and positive reinforcement can gradually help them feel more at ease with food. Patience, creativity, and respect for the individual needs go a long way in creating a positive mealtime experience and encouraging healthier eating habits over time. All right, my friend, I hope these tips were helpful in leading your patients through their autism journey. And that's all I've got for you today. Let's continue to make our patients healthier, one exam room at a time. I'll see you next time.